What is happening, everybody? Dr. Z here, Zulu Time episode number 145. And today we're going to be talking about type 1 diabetes. The main thing today, we're going to be talking about type 1 diabetes and what type 1 diabetes is, what the root of type 1 diabetes is, and then what's wrong with treating it like type 2 diabetes and why there is such a big misconception in the public about this. And also what TRUGH medicine has to offer for this disease. And so, what is type 1 diabetes and how big of a problem is? Well, type 1 diabetes is when the body cannot control its own sugar, right? So I eat sugar, usually the sugar gets either turned into fuel or is stored. In type 1 diabetes, the body cannot do that. So the sugar keeps accumulating, and not only that, but then the organs don't have the fuel they need to be able to function. But how does that happen, right? And so type 1 diabetes is actually an autoimmune disease, meaning that auto and then like our own bodies, and then immunity, meaning that the immune system attacks itself. So our immune system is attacking ourselves against against something, right? And so what is being attacked is actually the cells in the pancreas that are making insulin. And the cells in the pancreas that are making insulin are called the beta cells. And so these cells usually make the insulin. The insulin is there to lower the sugar in our bodies, to store it, to use it. As to what's the reason of why our body attacks itself like that, we don't know exactly, but we do know that the repeatedly attacks on the beta cells in the pancreas, repeatedly, then that ends up creating a problem with these cells that cannot produce insulin anymore, and so over time, the cumulative destruction of these insulin secreting cells create type 1 diabetes, and over time, the cumulative destruction of it then results in severe insulin deficiency. So there is no insulin in the body at all, and that's when people start having symptoms. Usually it's young kids that have this problem, and they come into the doctor with severe weight loss, with a lot of thirst, with a lot of problems. Some of them come even almost dying from something called diabetic ketoacidosis, because all the sugars start turning into ketones, and the body starts turning very acidic, and then the person ends up into a coma. We have this all the time in the ICU. We have to put the patients into the intensive care unit because their body becomes so acidic. So usually it happens in children. About 3 out of 4 patients with type 1 diabetes, but we're seeing that grow so much. More and more kids are growing. They say it's about 5.3% growth per year that we have more diabetes, and from 2005 to 2030 is supposed to increase the amount of people, of kids who have type 1 diabetes. And so that's kind of what type 1 diabetes is in a nutshell. Then now we want to talk about what the root of type 1 diabetes is. So what is the root of type 1 diabetes? Well, the root of it, again, I always talk about this. If we're going to look at the disease like a root, first we have the symptoms, right? We have the symptoms, and then we have the possible causes, and then we actually have the root causes. So in terms of the symptoms, we're getting weight loss in kids, or over time weight gain. It can happen. And then we have severe thirst, severe urination, mental cloudiness. Over time, you start losing your eyes, losing your kidneys, losing your heart. One by one, these things start going. So over time, this is what ends up happening. So that's the symptoms, right? And then the source, the cause of it is, we know that there is no insulin in the body, right? But then what is the root cause? The root cause, we know that part of it is going to be that the cells of the pancreas are being destroyed, right? But we don't know why. Why were they destroyed? Well, studies have been shown on this, and we know that there is a couple environmental factors that might affect this, right? One of them is decreased vitamin D. Another one is infections, like some kids get viral infection, and that triggers the immune system, and then the immune system just goes crazy. It's almost like PTSD of the immune system. It had to fight something, and then it has to just continue to destroy other things. And so, but 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 is it all genetic, right? Well, so how does the genetic work? We know that there is a little gene called the HLA gene, right? And we all have this gene, and different variations of these genes can make us predisposed or have the tendency to develop type 1 diabetes. We know that there is a specific little changes in this gene that can make us anywhere 5 to 40% more likely to get type 1 diabetes. But the actual inappropriate attack on these cells happens for different triggers. Like I mentioned before, some of them are infections, some of them are stress, some of them are toxic substances. So it just depends, and there is not one exact. So we can kind of draw out which ones are possibly, but we don't know, right? This is a great moment to talk about a concept that I always talk about, which is the concept of the point of inference. This concept, not to go off the tangent too much because that's for another podcast, but this one is the Dalai Lama was talking to a quantum physicist, and they were going deeper and deeper and deeper in the theories. And the Dalai Lama said, "Well, past a point, I don't know. I don't know what happens. It's an inference." And then the quantum physicist, Dr. Selinger, said the same thing. Hey, past this point is only inference. I don't know what happens. And this is the same thing in medicine. When I watched that, I was like, wow, this is the same thing in medicine. A lot of the diagnoses we learn, but there's a past a point that is a point of inference. We don't know past that point. That is the point of inference, my friends. And this point of inference actually changes as we get more technologically advanced. It's a moving target. It gets better and better and better. So this is where the point of inference stops with type 1 diabetes right now. And so what is wrong with treating type 1 diabetes like type 2 diabetes? Well, that's what I'm going to talk about right now, because it's completely wrong to treat them as the same disease. It's almost like going to a mechanic and you have, you know, one of the piston goes off in the motor, and you treat everything in that car as if it was the same problem when maybe it was an electrical problem, right? And so the root cause is a completely different cause. Even though the symptoms might be similar, the root cause is completely different. So, and how did this happen? Well, you see, what happened is that insulin was firstly, it was discovered, right? And then when insulin was discovered, everybody in the world was like, "Oh my God! Like we have the treatment um, for diabetes. Like it's resolved. Now we know how to deal with it." But that is not completely the truth. Not only that, but it's far away from the truth, because type 1 diabetes is the only disease that is the lack of insulin, that there is no insulin in the body because it's been attacked. The factory of it is being attacked and destroyed, right? But in type 2 diabetes, it's like almost kind of like the opposite. There is too much insulin because um, it's become insensitive. It's almost like taking a key. If we think of insulin as the key and our organs as the rooms in our house, think about the key, like use it so much that the key doesn't work anymore, right? And so you can't open the doors anymore to put the sugar to use because the keys are so used that you cannot open the lock. And so that's type 2 diabetes. And so the problem is that if you treat type 2 diabetes with the same as type 1, is completely not the root of the problem. In type 2, it's actually too much insulin, right? You see what I mean? And so, but that's what is the big misconception around the world, thinking that we're going to treat the two diseases with the same thing. So type 2 diabetics get insulin when they actually need a change in their mindset around what this disease is, and education on what it really is and how to actually change their behavior so that they can actually overcome this disease. And so that's what it is. So today, that's the end of it. So today we talked about what type 1 diabetes is and why is it such a big problem. We talked about the root of the disease and what is the actual root of the disease, and then what's wrong with treating it like type 2 diabetes. And what Thrive Medicine has to offer is that Thrive Medicine is pretty much looking at the people who are thriving, right? And how do we hack that's thriving? How do we look at what they're doing right and just hack it so that then we can get a type 2 or a type 1 diabetic and start helping them carve their way into on stopping unnecessary suffering. So that's what it's all about. All right, everybody, that's it for Zulu Time episode number 145. Until next time, and remember, take it easy.